mommy makeover. It's sort of restoring what you had before you had kids. For most women, is their breast after breastfeeding and maybe perhaps losing some volume in their breast and the abdominal area. With the tummy tuck, obviously, it's a very powerful technique. It gives the patients the most ideal location for the scar. So a lot of my patients wear a bikini. The way I tighten the skin, it pulls their skin of their legs off. So a lot of times my patients say, wow, I got a little bonus thigh lift out of it, even though that was not even the purpose of the operation. It gives the best possible looking scar because of the way I close the skin. I do a lot of liposuction at the same time, which is not possible with other techniques of tummy tuck. And it's not safe with the other techniques, but with my technique it is. After the initial 2 months of recovery, go get a trainer, get a physical therapist, somebody who can coach you to make that connection from your brain to your muscles that has been turned off for many years. And that's the key for my patients. I really emphasize that for them.